We're now going to discuss infant CPR. Infant CPR is exactly the same as adult or child CPR, particularly the rate and ratio, but they're smaller. So we have to modify our behaviour for the smaller person. So let's go up and make sure the area is safe and there's no apparent dangers here at all. And with an infant, we just have to think a little bit smaller because they are smaller, and use our compressions and breathing smaller as well. So let's have a look for a response now. Hello, wake up, can you hear me? Of course, an infant under 12 months is not going to respond verbally to you, but they usually cry, open their eyes, or move their arms. If there's no response at all, then what we need to do is move through the steps. The next one is send for help. Okay, 000 for an ambulance. Mobile phone 112, as we explained before. Now we need to check their airway. Just have a quick look in their mouth. You don't need to tilt their head back. A baby you can leave on their back just like this with no problem at all. If their mouth is clear, that's fine. Now what we need to do is check for breathing. Put my hand on the baby's chest and listen. I can't hear any breathing. So they're not breathing and they're unconscious. Now we need to start compressions. Visualise the centre of their chest, or just between their nipples is fine. With 2 fingers, press up and down like this 30 times. (29, 30). Then some children you can put your mouth right over their mouth and nose, or some you may need to pinch their nose shut. But tiny puffs, about that much air, or blowing at a candle. 2 breaths, followed by 30 compressions. If all else fails, as I said before in the other part of this DVD, is if you only can do compressions, just continue with compressions. With a small baby though, we'd much rather you do 30 to 2 if you can. You can even cradle them like this and press here while waiting for the ambulance 30 times. 2 little puffs. Infant CPR. I hope you never have to do it, but this is how you do it.